What gives this variant an opportunity, Scott? And does that opportunity present itself anywhere in the United States, specific areas of the United States? Or is this really, can we look at this as more of a problem for the rest of the world that might not have the same vaccination percentages that we have?
Well, look, I think it's a global problem, but the problem is different depending on where you are. This strain is more transmissible. It looks to be about 40% more transmissible and will become the dominant strain around the world and in the United States as well. I think when we look at what other countries are doing, when we look at Israel, when we look at Australia, when we look at countries in the Pacific Rim, they have a different goal than us. Their goal is to get to zero COVID. They want to keep COVID out of their countries. They don't want to see any transmission. Here in the United States, we're not going to get to zero COVID. This is going to become an endemic illness, and our goal is to try to reduce the death and disease caused by this infection. And we're doing that through vaccination. By getting vaccines into the more vulnerable populations, we're going to see hospitalizations and deaths as a result of this strain be dramatically reduced. Now, that said, there are pockets of the country where immunity is low, where there isn't a lot of prior infection, where vaccination rates are low, and those are the vulnerable parts of the country. And if you're someone even who's vaccinated living in one of those parts of the country and there's a dense epidemic of this new Delta variant, you're at risk as well, because we know the vaccines aren't 100%, and we know in vulnerable populations, people who are immunocompromised, people who are much older, the vaccines may not work as well over time. So the goal should be to try to reduce transmission as much as possible here in the United States. I don't think we should be cavalier about this, but we're going to see the overall impact of the virus be substantially reduced because so many people have become vaccinated.
All right. So what is the right response? Is California taking the right response at this time? Are they overreacting? What is prudent and but not not overreacting?
Look, I think the right response, first and foremost, is to get more people vaccinated. I think to do that, we're going to have to shift strategies and get the vaccines into the hands of providers and have a more bottoms-up campaign to get people vaccinated. Right now, it's been a top-down campaign led by the federal government. That worked. That was good. We got a lot of people vaccinated. But this needs to be more of a grassroots effort. We need to deliver vaccines in doctors' offices. I think in terms of the mitigation, we're at a point right now where our mitigation really should be reactive, not proactive. We shouldn't be shutting things down, putting in mask mandates in anticipation of spread. I think we should do it when we see signs of spread, when we see signs of outbreaks. So certainly states like Missouri, where you're seeing very dense epidemics right now, they need to think about what they're going to do to try to solve that. But I don't think that we should be implementing mask mandates right now, given how low the prevalence is overall, and given the fact that most of the vulnerable population, or many of the vulnerable population, many older individuals, have been vaccinated, and the overall risk to the population has been substantially reduced. If we start implementing these public health mandates now, in the absence really of a lot of spread, we're going to lose the credibility to implement them later when we need to, if in fact this does become more prevalent in the fall, which I think in certain parts of the country it will. This isn't likely to be a national epidemic, but there will be pockets of spread and regions that get engulfed in, resurgence.
This is not the first variant. Obviously, there's been, there's been thousands of variants, and somehow some get selected for and become more prevalent. This won't be the final variant either, Doctor?
Well, look, I think we need to start thinking about this not in terms of the strains, but the mutations that underlie these strains. And we've seen a finite number of mutations that this virus has incorporated that could allow it to partially defeat some of our immunity or make it more transmissible. This new variant incorporates two different mutations, one that we found in the Los Angeles strain, one that we found in the South African strain. And when you add up those two mutations, you get a very different kind of variant that spreads more easily. There's actually multiple forms of this Delta variant, and the one that's spreading here in the United States seems to be covered well by the vaccines and also doesn't seem to be piercing the immunity offered from prior infection. There is one version of this Delta variant, and some people are referring to it as Delta Plus, that based on the experimental evidence, there's a suggestion that the vaccines don't work as well against that variant. So that's what people are concerned about, that variant could start to take off. So far, this version that's spreading here seems to be outcompeting it. Maybe it's more transmissible and will continue to outcompete it. But there are some strains floating around that we have concerns about insofar as the vaccines may not work as well against them, or the existing vaccines may not work as well against them. Now, that said, if this current variant becomes a predominant strain here, the hope is that it crowds out other variants that could, perhaps be more menacing.
Hey, Scott, coming this fall, Broadway's planning to reopen. In some cases, they're going to do testing regimens, no mask. There's obviously lots of businesses that are bringing workers back to work indoors. Does that concern you? How should people think about that? Do you anticipate wearing masks in the fall as a result of this if you're vaccinated?
I don't think the fall outlook is out the window. I think we should still look forward to relatively low levels of infection around the country, in most parts of the country where vaccination rates are high. And that's certainly true in the Northeast. It's true in Northern California. I think there are going to be parts of the country where you see prevalence pick up. And I think for people who are vulnerable, who face more substantial risk from COVID, they may be seeking boosters in the fall to afford them better protection. And there is some evidence now that the boosters do provide more protection on top of the existing vaccines. Some people may choose to wear masks in certain higher risk settings. Some people may choose to withdraw certain activities while the prevalence picks up. But I don't think it's going to be a raging epidemic across the country like we saw last winter. I think that there's going to be pockets of spread and prevalence overall is going to pick up. But I think, in parts of the country where vaccination rates are high, and that's certainly true in the Northeast, I think we're largely protected, at least from the current variants that are circulating.
Shepard Smith here. Thanks for watching CNBC on YouTube.